Let's talk about waiver changes that are here as of July 2025. So if you are on the health and wellness waiver already, you are familiar with getting an assessment every single year. Every single year, your waiver case manager comes in and they will do the same assessment. If you are a Tendercare family and you are waiting to be placed on the waiver because you're on a wait list, then you may or may not have already had this assessment. But you have to have it when you first join the waiver to make sure you're eligible for the waiver, and then every year after to make sure you're continuing that eligibility. And today you are familiar with your waiver case manager coming in and completing that assessment. So starting July 1st, FSSA has changed two things. They've changed who will be doing that assessment, and the second thing they have changed is the assessment itself. So starting July 1st, you will be contacted by a company called Maximus, and Maximus will be facilitating and doing those assessments instead of your waiver case manager. So the second piece to this is the assessment. So today, FSSA has been using the adult assessment, right? The adult NRRAI assessment. It's a very long, wordy assessment. Starting July 1st, they are using the same NRRAI assessment tool, but for pediatric patients instead of adults. And so what that means for families with kiddos, right? When ages 0 to 3, you will have an early years assessment. And then from ages 4 to 17, you will have a separate pediatric assessment. And, the criteria that they're looking for to determine if your child meets eligibility for the waiver is, do they meet Indiana's definition for nursing facility level of care? And what that means is, does your child have 3 activities of daily living they need assistance with, or do they have a skilled need? And that assessment criteria is exactly what they've always been assessed for, so that is not changing. The way that a person is assessed, that assessment tool will change in a couple of different ways that will be new to you. So this new assessment, the pediatric assessment, is looking more at the whole person care. So they're talking about areas, not just physical health, but they're incorporating mental health. If your child has an intellectual disability, who are paid caregivers and unpaid caregivers supporting your child? They want to know about all the services that your child receives, from waiver to PA to even school-based services. And they're also going to ask questions about what Medicaid likes to call the household dynamic. So how many other children are living in the home? How many other caregivers are in the home? Who works? Did you have to quit your job because you are taking care of your child? So those kinds of questions. And those will be different, right, than what you are asked today. Really, in today's adult assessment, you've just been asked about your child's physical health. So these categories are new. The other big difference that you'll see is that the pediatric assessment tools take into account the age of the child. So when they're looking at sort of, does your child need assistance with 3 ADLs, or do they have a skilled need? Do they have those? Do they need help because of their age or because of their disability? So a really good example of this that I share with families is, if your child is an infant, every infant needs assistance with changing their diaper. And that is not because of their disability, it is because of their age. So likely that activity is not taken into account as an ADL they need assistance with. So the next category is the health and wellness waiver eligibility. So again, as we talked about Maximus, the new vendor coming in to do your assessment, they will fill out those results. They will send them to FSSA, and FSSA is the final decision maker on whether your child meets waiver eligibility, right? 3 ADLs or skilled need. If they determine that your child is no longer eligible for the health and wellness waiver, families have the option to appeal, and you will receive a letter in the mail telling you how to do that and walking you through the steps. And of course, Tendercare is here to help you and support you through that process. If you go through the appeal and FSSA still determines, you know what, we don't see that you meet eligibility for the health and wellness waiver, they are going to do a second assessment. And that second assessment will determine if your child meets eligibility for one of the other types of waivers, specifically the family supports waiver. And FSSA has allowed priority placement for families who may not meet health and wellness waiver eligibility for families to join that waiver. One of the caveats about that waiver, the family supports waiver, is that structured family care is not a service option on the family supports waiver. However, they do have a service, we call it PAC, or participant assistance and care, but you know, we love an acronym in government. So that service is available. Right now, it only allows guardians of adults, as far as family caregivers go, to provide that level of service. But DDRS will update it coming this winter. So those are the big changes you will feel. Your waiver case manager will still be coming out quarterly to talk to you about your different services. Your attendant care, your structured family care, you will still have that person on your team. They are just no longer doing the eligibility assessment.